If you're new to it, if you could everybody put the microphone on mute, please, unless you want to speak, obviously, and then unmute it. I'll attempt to chair it as best I can. And item 1 is customary to have Jeff Little on the COVID update. Over to you, Jeff, please.
Thanks, Chair. First of all, on the progress of the pandemic, for Bury, as of this morning, we'd had 354 cases. That's an increase on 6 on yesterday. So the cases are still rising. Nationally, as members will know, around 15,000 deaths. Just a reminder, we can't report deaths at district level. We don't have the up-to-date, accurate data from ONS. But the figures show that although cases are still rising, the rate of increase has slowed, and that backs up our point from last week's EPG that the peak is clearly going to be, and is now turning out to be, flatter and longer than we had originally feared. Overall, figures are changing. There isn't enough yet to establish a trend, but we think that the likely outlook, and it's only a likely outlook, is that over the next 4 to 6 weeks, we may start to see a slow fall in new cases. It won't be a straight line, there'll be ups and downs, but it does add up to a picture that is at least showing some movement in the right direction. And therefore, there is a slight mood of optimism that this could be at least moving. And that gives us encouragement to advance our work on both the pre-recovery and the recovery phases. Pre-recovery being our planning for that tail of cases, which will free up capacity in the health service and in social care, and also pre-recovery in terms of the lifting or partial lifting of lockdown restrictions. None of us knows yet what the government's decisions will be about when there might be a lifting of restrictions, how that will be managed, but we need to be thinking that through and being ready for it as a borough. It will be a major logistical exercise for us all. We are, though, on that basis, thinking about the recovery phase, and you can see initial elements of that work on today's agenda with Lynn Ridsdale's item on the future of the community hubs and how they link with health and care and children's support, but also Paul Laken's paper on thinking about economic recovery, including in our town centres. Over the past week, we've been focused on 3 big risks in the part of our response to the COVID-19 epidemic on health and social care. And those 3 risks have been the adult social care system, PPE and testing. I'll give a brief update on all 3. There have, of course, been concerns about the impact on our residential care sector and about the providers of home care in the borough. We've seen the numbers of new cases in residential settings increase. We've seen real pressures in terms of staff self-isolating, that's staff working in home care and in residential settings, and that leading to a need for more testing in social care of staff. But also we see the higher acuity of patients being discharged from hospital into residential care, and again that leading to a need for testing of patients before they leave hospital and go into residential settings. And finally, real concerns in social care about the availability of PPE. The actions we've been taking this week to respond to those issues in social care have included really fantastic work by primary care, with GPs and practices pairing up with homes to make sure that there is real clinical support available to residential care homes. That includes detailed conversations with the residents most at risk in terms of their future care packages. It includes mutual support on some of the practicalities, such as PPE. It also includes making sure that care homes know that if they want support from clinicians in primary care when they are dealing with high acuity patients being discharged from hospital, that support will be there. All of that work has started. There's more to be done, but I'm pleased to say that primary care is really working with social care in its hour of need. I would add to that, at Greater Manchester level, we've developed a new tracking system so we understand in real time what the pressures are in residential care. Now, this extends to residential care at the moment. We aren't yet able to do this for home care. There's a system that will roll out in the coming days and weeks, which will be very similar to the system that measures pressure in the acute part of the health service. There's a system called OPAL, where as hospitals come under increasing pressure, they're able to trigger responses through the OPAL system. The system for social care will be very similar to that and will be really helpful in helping us all to monitor pressure in adult social care as we go through the peak of cases. And I think that's a good example of an increasing awareness nationally and locally of the critical importance of social care in the wider health and care system. Turning to the second risk this week we've been managing, that of PPE. We discussed this at last week's EPG. I think this week compared to last week, we are relatively, less unstable than we were then. Our stocks of PPE in the central store we hold in Bury, which is supplied from the Greater Manchester Resilience Forum, is relatively healthy. We are therefore in quite a tight but manageable situation at the moment. However, it is tight. We've distributed from that central store over 93,000 individual items of PPE so far. That's responding to over 100 requests from social care, primary care, other out-of-hospital services. At the moment, we've got about 53,000 items in stock. It's a very rough picture because obviously the nature of the items differ, and to get a full picture, you need to understand the particular needs of individual parts of the system. And we do have that data from daily surveys that we conduct. So we're keeping our head above water on PPE, but it is, as I say, incredibly tight in terms of the resilience of that system. We have benefited from the work of Greater Manchester on PPE tremendously. The Greater Manchester Resilience Forum has been really helpful in getting supplies, not only from government sources, but from the private sector, from our own procurement. And that is being distributed to all the districts and is helping us have that central backup supply in Bury. We will need to keep a very close eye on this, and we're monitoring the details day by day. Thirdly, and finally, in terms of health and social care testing, so overall, in terms of capacity, we think we've got enough capacity for all frontline staff who are either self-isolating at home or otherwise in need of testing to get tested, particularly those staff who are self-isolating because either they or their family are symptomatic. This will be really important in getting more of our staff to come back to work as early as possible, and important in terms of getting those staff reassured, if they can be reassured, that they are not positive and then they can get on with their lives. Our big task now and going into next week is get the messages across to staff and their managers and their organisations how this works, where they go for testing. There are a number of different types of testing facilities around Greater Manchester and within the borough. So it's quite a complicated picture. If you need to get out to staff and their managers, where they go, when to go, and what they do when they get the results, how they liaise with their managers, and if they can, how they get back to work. And we want to be able to communicate to the public that that system is in place, so they are assured that they are looking after our staff. And most of all, we've got to start monitoring that to make sure it's actually working in practice. Just on the wider picture on testing, clearly long term, the answer to COVID-19 is a mixture of population level testing and inoculations. So we've got to make sure that Bury is ready for that. There will be a reintroduction, we think, in due course of both testing and tracking of cases. So we in Bury need to be ready for the tracking system, and Public Health are really working with other partners in GM on how that will work for us. So more to be done on testing, both in a tactical sense here and now, but in terms of that long-term testing being part of the answer. Just moving on to some other areas of priority, support to business. So looking at the OBR projections last week, we can see that they are predicting a real terms GDP fall of up to 35% in the second quarter of this year. That is a massive, deep recession. And there are various predictions, but the worst case scenarios are for a U-shaped rather than a V-shaped recovery. So we are really focused on recovery. There's a paper by Paul Lakin later on the agenda about how we might start to focus recovery for the economy of our individual town centres. We are at the same time focusing our recovery on different sectors of the economy in Bury, and the work with Deloitte on how to focus that work is included in Paul's paper. Just to update though on the grants, because unless we can keep as many of our businesses surviving over the next few months, the recovery won't be helpful to them because they won't be in existence. So the £10,000 grants that are available, we've now got 16.6 million of those out. The £25,000 grants, we've got 5.4 million of those out. So in total, we've now distributed over 22 million to Bury businesses, and that's well over 50% of the total. So we're getting there. The impediment to getting there fully is the lack of information from businesses about their bank details and how we get the money to them. So we're writing to those businesses, we're emailing them, we're phoning them up, we've got extra staff on the case. We're working through the business leadership group to get their help on getting the information out so we can get more grants out to the businesses that need it. All of that work on business support is being supported by the Bury Business Leadership Group, chaired by Andy Roberts. Councillor Simpson was on the latest meeting of that group today and may want to add to what I've said. Finally, Chair, in terms of this week, a decision was taken by the Greater Manchester Combined Authority yesterday that in a planned way there will be a partial reopening of the waste recycling centres. We think that will happen around about 2nd of May. The details of how that will work district by district are still being worked through. It will be a partial, not a full reopening. And for Bury, we are working through the details of what days of the week, whether it be weekends only, which centres, etc. And most importantly, how we manage that and what support we will get from Greater Manchester to manage that partial reopening. So a lot of work to be done on the detail. Sure, we can bring back a full report on that to EPG next Thursday before the opening happens on or around about the 2nd of May. Finally, I just want to give a quick forward look on the issues uppermost on our agenda for next week. We are looking quite intensively at mental health, at a community level in particular, how we embed mental health services into the work of the integrated neighbourhood teams for health and care, the community hubs, and the early help for families. Secondly, I've mentioned recovery a few times. We will be stepping up our work to have an overall borough plan for recovery, and I hope to be able to bring more details of that back for next week's meeting. And finally, Chair, in all of our work, we're now starting to pay more detailed attention to equalities, both in terms of the impact and the response in the most deprived neighbourhoods in the borough, and the community hubs will be key to that, but also in terms of Black, Asian and minority ethnic communities and faith communities in the borough, how the COVID-19 crisis is affecting those, what the impact is, and how our response and the recovery phase needs to be tailored to those particular impacts. So very happy to answer questions or take comments on any of that, Chair.
Thank you, Jeff. Thank you. My quick impression was that's probably one of the most upbeat briefings that you've been able to give us so far during this emergency. There seems to be the shoots of some new life coming, with a couple of exceptions, obviously. There's still a lot of work to do around equalities, recovery and mental health. Andrea, did you want to add anything from the Business Leaders Group this morning?
Not really. I think there are some issues around the self-employed again. There's a group of people that have only just started businesses that are really struggling because they haven't got, they're not eligible for the government scheme. So that's an issue. But no, not really. I don't know if Jeff wants to add anything. No.
No, thank you.
The only thing I do want to say, just from Jeff's opening speech, is that I think that the relationship that's now forming between the GP practices and the care homes is really unique, and I think it's really good. Now, I know in other areas they have like a big care homes practice, but I think in Bury it's the right approach to have individual practices within those localities, having those relationships and working with those care homes. So that's the only thing I would say. I think we've got the right approach.
Thanks, Andrea. And of course, Dr. Schreier's on the call as well today, so I'm sure he's registered that good message. Any other comments from colleagues for Jeff?
Chair, could I just ask something to Tim?
Hello, Tim. Yeah, of course you can. Go ahead.
I just wanted to ask a question about residential care homes, because I guess obviously that's and I know will be of concern to everybody. And it's just about what measures we're able to do to support care homes, essentially to prevent transmission, I guess, really. So I guess, obviously there are different staff going in every day, and as Jeff said, there are people arriving, having been discharged from hospital every day. So I'm just wondering how we are able to support care homes essentially to prevent onward transmission to residents, which I suppose is a slightly different issue to PPE issue, which is more of a safeguarding staff issue, I think, really. Does that make sense? Thanks.
It does, Chair, and Councillor Simpson, Jeff Schreier, others may want to comment as well, but a few thoughts from myself. First of all, the point you make about patients being discharged from the hospital is very, very important. There have been concerns that might have led to infection in some of the care homes. There have been improvements over the last week in the discharge process. All patients are now tested before they are discharged, and there's a longer period of assessment before they are discharged from the hospital into the care home. So we are seeing a tightening up of practice in that area. There may well still be more to be done. Secondly, when there are infections in care homes, our public health infection control team go in and provide hands-on help and advice on how to control that within the care home. And the point that Councillor Simpson made about support from primary care is really important, because that support can augment the infection control work. And then after that, it's down to really good practice in the care homes, despite the fact they are under enormous pressure because of the acuity of cases they've got and the number of staff they've got self-isolating. They are doing a brilliant job at both through PPE and through the management practices, controlling the virus as much as they can. Our One Commissioning Organisation commissioning staff are in daily contact with all the homes and have built up a really close and supportive relationship with the care homes. The care homes know that our team are there to help them on all of those matters. So the homes are under tremendous pressure. But I think between the One Commissioning Organisation, primary care and the acute sector, we're all doing our best to make sure they are supported through this.
Thanks, Jeff. Anybody
Dave.
else?
Dave, can I ask a few questions?
Bob, please do. Thank you.
Right.
Sorry, Dave, I wanted to just come in on that point.
Oh, hang on 1 second, Bob. Andrea, I didn't catch
Yeah,
you.
yeah, no
It's
problem.
all right. Just to say, we're planning for the future and how sort of the health and care sector is going to look in the future. One of the suggestions that we made was having infection control champions within the care homes to work with the infection control team, because infection has been an issue within care homes. It's bound to be because of the amount of residents that are in the care homes. But just moving forward, I think we do have to learn the lessons from this episode and make sure that we safeguard our care homes in the future. Thanks, Chair.
Thanks, Andrea. Bob, please go ahead.
Right, it's quite a number of questions for the two Jeffs. First of all, how is the state of our ECU beds in Fairfield and I presume Crumpsall in terms of usage? How close are we to total capacity? That's the first. I mean, if you want to, there'll be another question leading on from depending on your answer, Jeff.
Okay. So far, the level of use of critical care beds in Fairfield and across Greater Manchester is well within the level we will need as we go through the peak. So far, so good. So, for example, the Nightingale Hospital in Manchester is not in any way overburdened at the moment, and in Fairfield and other hospitals they've put much more capacity in, and there is headroom within that capacity. So far so good. Okay, so from that, if you remember, one of the first papers you brought to us was the way we were going to look at the whole situation in Bury, and one of the items in there was that we would be purchasing and leaving empty beds in care homes in order to cover us for the expected demand for ICU beds, and we would move the patients who were in there for normal operations, whatever it was, if an operation's normal, into the care homes, and so we kept these blank beds there, and we were paying the private care home owners. I mean, I've got to say again, I did tell you 3 weeks ago there was this problem that you weren't allowing for this 24-hour testing, which you could see on the horizon was going to transfer the disease from the hospital into the care home. So that's neither here nor there. I mean, the question then is, how many of those reserved beds have we used? And at what point are we going to stop paying this £750 a week for these beds? Are we going to decide that we've reached the peak? Because I know we're being covered by NHS England into the CCG for all costs, but we have a duty of care to the taxpayer against the private companies. So that's what I'm interested to know, Jeff. Yeah.
Thanks, Chair. So I haven't got figures at my fingertips on the amount of available capacity in the residential care sector. I will get that for you. I would comment, though, that we are not through the peak. We are not actually at the peak. We know the peak will be longer and flatter, and that's why there is capacity in the health service at the moment. But we do not know, as we go forward, what the actual figures will look like. And therefore, it does, to me, seem absolutely prudent to make sure we have the capacity in the system. We will, of course, monitor this on a day-by-day basis, but at this moment in time, I don't think anybody's talking about reducing capacity either in the hospitals or in the care sector, either for COVID-19 patients or in the care sector, COVID-19 or non-COVID-19 residents. The system is under pressure and we need to have some headroom.
Did you have another question, Bob? think that's a no. Any other colleague have a question of Jeff Little, please?
Just a very quick one for me, please,
Yeah,
Lee.
go on, Eamon. Yeah.
Jeff, could you clear up the debate happening nationally about the number of tests happening versus the number of capacity for tests? Because what seems to be saying is the capacity for tests is much larger than the actual amount of tests. Is there a reason why there's such a discrepancy, and is there anything we can do locally to ensure we're maximising the capacity as much as we can, whether that's in Bury or across Greater Manchester?
Yeah, so I think that goes to my comment earlier about the need to now communicate very effectively with all organisations in the borough who have frontline staff self-isolating because either they or a member of their family are showing symptoms. We have to get the message out about how those staff, well, first of all, we need to encourage them to get tested, and then how they go about it. I would say the range of types of testing centres at the moment isn't straightforward by any means. There's a major testing centre at Manchester Airport for NHS and other public service staff, police, social care amongst them. There's a centre near to Humphrey House in Bury, and then there is testing within the acute sector. So it is a complicated picture, and we are therefore going to be putting out all the stops to explain to staff and their managers how they use that system to get themselves tested. Testing, though, at this moment in time is of defined groups of public service staff. I'm pleased to say, we have expanded out from NHS hospital staff to cover social care, police, other frontline staff in schools, for example, much more comprehensively in the last couple of weeks. But there's still going to be, at some point, a need to extend testing more broadly than that to the public. So therefore, there will be a wider need for testing than we are currently experiencing. So there's two parts to the answer. One, we've got to get the message out about how people take up the supply, and secondly, we've got to be ready for a wider need for testing as that comes on stream.
Thanks, Jeff. And if I could just make a point about the figures you gave about workforce capacity and how, I think, was it GPs were below most others. I'm assuming that would also maybe direct us about the testing capacity. We know that there is a greater need in GPs than there is in some of the council workforce, for instance. If we're needing to make decisions, I'm assuming that's going to influence that as well.
Yes, we have that data, and again, that's about getting the messages out to the whole of the primary care sector that there is testing available for their staff. You are right, though, the data should also inform where we target our promotion of testing.
Can I just come in there, Dave?
Yes, please, Andrea, go ahead.
Just to say that, it's in practices, it's in care homes' interest to get people tested and get that turnaround, because I've got to say, working in general practice, we were waiting initially about 7 days for the results of the testing. The turnaround is now 2 days. So we're able to get staff back much more quickly. And the other issue is, with regards to the percentage of the GPs, that probably doesn't include all the clinicians, like the advanced nurse practitioners, the nurse practitioners. So those practices are likely to be much more stable because they've got that additional workforce that doesn't come into that criteria. But yeah, I mean, the other issue is we're not testing the public, and this is something that we should have that should have been really thought about. The issues are, I know, with getting the testing kits, But, you know, in other countries, we've got much lower cases of COVID and much lower deaths because of the initial testing that was done. I'll leave it there. Thanks, Chair.
Yeah, message received. Thanks, Andrea. Anybody else then? Any comments for Jeff? If not, are you there, Lynn, to give us an update on the community hubs, please?
I am. I've just switched on. Yep. Hi, everyone.
Thank you.
Quite a chunky report, so I'll just pull the headlines out, but happy to take questions.
Lynn, you say it's chunky. I thought it was a darn good read. It's National Book Week, I think, this week. I enjoyed reading it. Now, there aren't many council papers. I'm being serious, because it's what we're trying to do. It encapsulates. I'll shut up and let you speak.
Oh no, well, I'm delighted to hear that, because I'm hoping that this does feel like good news. This is potentially, you know, this is all our thinking, and we're going to grab it now and you know, make our reform dream happen. And we're doing it by building on what's already in place now, and the capacity in the community that's come together. It's exactly as it should be. So you see that the paper just tracks through what we've done so far, and gives some facts and figures around the amount of help that we've been able to provide and the capacity that we've drawn in. At the moment, it's all quantitative rather than outcomes focused. We will be absolutely getting to the point of performance managing outcomes. The one thing, and one of the many things I haven't put in here, is the detail of the app, but I'm pleased to tell members that the app has gone live this week. I think I mentioned it on the council update email. This is something that we have pioneered in Bury. We've taken it to Greater Manchester, who love it, to the extent that they are funding it for 6 months for us, on the condition that other districts are able to use the design. So Bury's gone first, and that is absolutely the way that we'll get our management information through. In the absence of that, though, we know just the numbers of people we're reaching and the feedback that we're getting is generally really, really positive, which is great. But the other big piece of progress is that a lot of the original scope has now been mainstreamed. So our day one focus was food and medicine for the most vulnerable. The food stuff is now sorted because of supermarket direct deliveries becoming more established to vulnerable people who can afford to pay for it. And the hardship stuff is being routed through the food banks, which I've tried to describe in there. Likewise, meds deliveries are being picked up by pharmacies direct now. So there is some work, particularly for higher risk users, that's still being managed through the hubs, but broadly that is contained. So what does that tell us? I think the first thing is that there's now an opportunity to develop the role of the hubs. They're clearly working, but if the basics are now taken care of, then these are teams that could do broader things. And secondly, the key point here is that we hope we've proved the point to our neighbourhood model. The hubs have been mapped onto the same footprint as the health integrated neighbourhood teams. The two things are working in a complementary manner. We always said that the third part of that that group would be a public service equivalent, where we would bring together all of the services that deal with complex lives and provide all age early help support for everything that isn't about health, effectively. So, you know, substance misuse, domestic violence, exploitation, all the other knotty stuff that would absolutely need to be identified early and gripped and managed on an active case management basis. This report says, let's do that. Let's bring to the table the third part of the team and establish those wider functions outside of health. Partly we think we need to, because we don't want everything to be directed to the hubs now. There's a risk that we'll kill the success by overloading it. So we need extra capacity around it. But also, as we've discussed here, we are very mindful that this emergency has presented other social issues that we need to be proactive around. I know members have been concerned around domestic violence in particular. And I'm able to give you a verbal update that the data I've seen this morning says that we did see a spike in the early couple of weeks, but in line with the rest of Greater Manchester, that has now settled and our case volumes are now at the level they were before. So good, but we need to be more proactive. But all the other work that we need to keep focused on around things like supporting the vulnerable children in schools, working with the police to manage enforcement of social distancing, that all needs a home. So our suggestion is that we set up a team that pick that work up. They work alongside the other two teams, and within the community hubs, proposing that we really embed that now to become, as it was always designed, a forum for the community to effectively look after itself. The idea was always that to have true community empowerment, it wouldn't be full of public servants. There'd be enough of us to provide the infrastructure, the advice and the support, but really our job is to give that infrastructure to the communities so that they can take responsibility for their own local issues, and they can pull together their capacity to respond. So what we want to do and what this paper suggests is that we continue to use the council resources to set all that up. We've got about 100 staff deployed across these hubs at the moment who will stay there, but absolutely with a view now to an eye to the longer term sustainability, to properly engage and develop all of that local capacity. But also, importantly, this paper is proposing that we broaden the offer in those hubs and that we make support available to the whole community, not just those people who are most clinically vulnerable. They will clearly still be a priority group, but assuming that their ability to remain in isolation is now managed through mainstream services, we are mindful that the next big demand that is on the horizon, locally we're seeing some of this, again, it's across GM and nationally, is the loneliness agenda, the low level mental health, increasing levels of anxiety. So the proposal is that we use those teams to be a place for residents to reach out to in the first instance, to absolutely continue to connect to local groups and volunteers that can help them with stuff, but also to be the, as I've described it in the paper, the friendly ear, a befriending angle, which is literally somebody to call for those people who don't have anybody else, to give them advice, to give them reassurance, but also trained with a model to literally have a conversation, stay connected, a way to engage socially, and to signpost them to other resources to help them. So to hook them up then with a volunteer that can maintain that contact, to point to our self-help resources on the Bury directory. And also it's referenced, but I can share with you the longer list of info that we've got together around Town of Culture, of just some positive digital resources that are available for people to engage creatively, to see beautiful things, but also groups that are operating digitally where people can get that level of social engagement. So the proposal is that we move towards that as our neighbourhood model now. It's absolutely what we always designed through Bury 2030, but I think this has given us an opportunity to shortcut. There isn't particularly a budget consequence at this stage, not really asking for any money, but it is absolutely a new way of working. We'll need to work through the detail, but it's here as a decision because this is very much now the grassroots approach to community leadership.
Thank you, Lynn. So, and there is obviously an urgent decision attached to it. So I'd just ask colleagues, are we in agreement that that this is an urgent matter that needs agreement today? That's the simple question for us, I think.
Sorry, I should have said it. It's here as urgency because whilst I'm presenting this as the exciting future we always dreamed of, it is absolutely still part of the emergency response now. Just to draw your attention back to the wider social issues that we need to manage tightly. That's the reason it's here today. It is a requirement today, but it does also give us the platform for the reform when we get into recovery. Apologies.
No, thanks, Lynn. So that's the question. Is it urgent? Does anybody think it isn't?
Dave. Oh, is that the question? No, okay. I had a couple of queries. That's all.
No, I'm going to invite comments in a minute.
All right.
Deal with the urgent decision. Everybody believes it's urgent. That's agreed. Okay. So, any questions for Lynn then?
Yes.
Got one from Andrea, and did you want to question Bob?
Yes,
so
please.
Bob was slightly in, Andrea. I'll just take Bob to you. Yeah, Bob, please.
All right, Andrea. Thank you. Are you okay? Yeah. Thanks very much. Just a couple of things, Lynn. I've got to reiterate what the leader said. Obviously, your kids have gone without food for a week because the mother can't have been cooking for them because this report must have taken you a year and a day. I mean, it was very awe-inspiring, I've got to say. A lot to take in. A couple of little things. You're now giving a bit more. You're now giving a bit more kudos to our voluntary groups under the VCFA system. And I do seem to remember a few weeks back when we had this rush of volunteers that we waived the DBS in order to keep the thing moving. But now you're giving them a bit more kudos, but the DBS hasn't kicked in. Is that something we need to think about? And the other thing was, you talk about community support being organised using local health and care service records, which is a little bit. I mean, there are people out there who don't particularly want you to know what their particular illnesses are, and I just wondered, did I misunderstand that?
No, thank you. Both really important points. As far as the VCFA and the community capacity goes, I think I'm reflecting back the progress that the VCFA have made now in amplifying the support they are bringing to this. When we set out, they were able to give us 100 volunteers within the hubs, which was easily matched by just local neighbours and residents that we'd pulled together. We've now upped that capacity to 500 people, which is really valuable. And not all, but most of those 500 people have some form of DBS clearance, which makes them really usable, as you've just indicated. So they're playing an important part of the team, but it's not all with the VCFA. There is still a massive, sort of rich seam of other less organised volunteers that we're working with, and we've still got a lot of work to do, I think, to create the space for everybody to contribute and to get the best of both. At the moment, we are triaging the requests for help according to whether people need DBS and the risk level that goes with that, and we're managing to spread the work across both. But I think the longer term strategy and how we pull together the very best of the organised groups and the informal system is probably our next strategic task. The point around records, no, we are being very careful with that. There have been ongoing difficulties with government in getting the shielded data and working out how useful that can be. The report also points to some of that, and we are mindful of information governance. Everything that we are doing has a data protection impact assessment around it, and really it all starts with, are you happy for your information to be shared? The vulnerable list that we have, we are not acting on, we're not directing that information to hubs now because we want to be careful. We're not sure that's the right thing to do, and we're not sufficiently happy with some of the quality either. But we are doing the cross-check internally within our own teams to make sure that our service users are picked up from that, and so to internally kind of stratify the vulnerability. But both of those are big issues for the next stage of analysis.
Andrea, did you have the point?
Yeah. I think, if we can retain these volunteers, that'll be a fantastic resource for the community hubs. And it's definitely the right thing to do to carry on with the community hubs. The only thing I'd say is about the location of the hubs. I do think we need to consider moving forward whether they're in the right locations, because certainly in Whitefield, I think we should be looking at the very deprived areas where those hubs could actually have the biggest impact. So that's the only point I would make. I think it'd be fantastic if we can keep the volunteers, retain them in Bury, but to do that, we need the resources to look after the volunteers, to do the training with them, to do the, follow up with them, to make that we look after him, basically. Thanks, Chair.
Yeah, and welcome thoughts as we go on how we might do that. I think my assumption is I'm hopeful that the volunteer numbers will balance. I think we will lose a lot of people when they go back to work, but we've also got a lot of older volunteers that are isolating or vulnerable and so aren't engaged at the moment, and I'm hoping we might get some of them back. But the art here is absolutely going to be, how do we engage people to such a level that they'd never not want to work with us within these hubs? And we need to think about how we do that. And I think there's lots when the time comes to celebrate and lots to say thank you for. There's more around, I think, the skills and the development, the social network. So we've got some early ideas, but as we go, members' advice would be really welcome, please. And I'll look at location. Yeah, we just moved quickly on location in the early days, but yeah, absolutely happy to look at that.
Thanks, Lynn.
Thank you, Lynn. So there you go, colleagues. An open invitation to pass your comments through to Lynn. Are we all done on community hubs? So the next item then is Paul Lakin, who's going to talk to us about the town centres of Well, I'm assuming all the town centres, but perhaps particularly Radcliffe and Prestwich. Is that right, Paul?
Yes, it is. So essentially what we're doing is starting to think carefully about recovery, and in particular concerns I think we've got over the future of our town centres. In particular, anyone reading the press will have noticed that the physical retailers who were struggling well before this crisis broke out, it's getting more difficult. A number of firms have gone into administration in the last few weeks, and companies like Debenhams and Marks and Spencers continue to shed stores when they get the opportunity. So we're quite concerned, in particular on Central Bury. I mean, it is one of the best retail centres, but that means it's got a lot to defend as well. Also, the food and beverage sector and the leisure sector more generally around the Rock area, and with other outlets of those kinds, those companies are in contraction mode at the moment. And then another group I think we need to be really cautious with, which is the independent restaurants, cafes, bars and pubs. Our business group that met earlier noted that a lot of the pub chains are not allowing tenants any relief on their rents at the moment, despite the fact they can clearly not trade. But we have a lot of small businesses, and the centres of Prestwich and Ramsbottom, and to a degree Whitefield, have seen a lot of restaurants, cafes and bars. And if we lose too many of those, those town centres will start looking a bit hollowed out, and there'll be some challenges for us. So what we're looking at doing is, and not in an entirely dissimilar way to the way Lynn's described, is creating some town centre economic recovery and growth stakeholder boards, which effectively helps to bring people, key businesses in those areas, around the table to work with us on the plans and the redevelopment plans. So we have real voice from enterprise and entrepreneurs, because they're ultimately the people who are going to have to fill those centres. So that's our thinking at the moment, that we're going to have to step up this work. Some of it will align nicely to the regeneration plans we've got in some of those areas. In others, it'll be a first step into having some sort of formal way of working in some of the towns. So I'll hold it there, because I know you're on quite a harsh timeline today.
So any comments for Paul then, colleagues?
Chair, can I just ask a question, please?
Of course you can, Paul.
Paul, your silver and gold panels that you talk about in this, I assume councillors will be involved, but will the local MP, the Bury South MP, be involved? Because Radcliffe and Prestwich is in Bury South, and I know he'd quite like to be involved in that. So is that something you were thinking about?
Yeah, we've not got into the details of involvement. In the same way with the community hubs, we don't want it to be dominated by the council, but I do think there would be some benefit in having MPs, in particular, given that we want some government money in the end for some of those big schemes in places like Radcliffe and Prestwich. So it would seem sensible, but we need to just work through the details of how we're going to form them first.
Yeah, I was just going to say it would be because two town centres fall in his seat.
Yeah,
obviously, it'd be helpful if he was on, because obviously he can go back to government and say we need, what we need and where we can go forward. No, that's fine. Thanks, Paul.
Okay.
Thanks, Chair.
Thank you, Paul.
Dave, it wouldn't be normal without me asking a question, would it?
Just let me comment to Paul Cropper.
Sorry,
I have had a conversation with the chief exec about Christian Wakeford's presence, and we are trying to work that through. So be assured he won't be ignored. Put it that way. As Paul Lakin said, we want some government money.
Yeah. Thank you, Chair.
Bob Caserta, off you go.
You've got this 200k from Andy Burnham's pot. How do you see the situation now in view of what your first 10 minutes of this report, the Rock and Millgate, etc.? How do you see the state of Longfield going forward now? In view of the Istanbul and what we were planning or talking about planning, how do you see that now? Because you mentioned 2008 in your report, don't you? So just give us an idea of what you think the next 12 months is going to happen to Longfield.
Well, I think it's wider than just Longfield, because it's about what happens with that wider Prestwich site. I think I don't think we should see it as necessarily gloomy. I mean, Prestwich hasn't got a lot of box retail or fashion retail. The vulnerability is there's quite a lot of small businesses in the food and beverage and drink sector. But I don't think, in terms of the sort of scheme we're looking to bring forwards there, I think we're looking at something that has a mix of kind of workplaces, residential, and it's going to be done over a number of years. So I think the prospects for that scheme will be enhanced by us being smart about the kind of commercial mix down there and not trying to lock ourselves into, certainly, I mean, if we had a big cinema anchor to go into Prestwich right now, it would be looking a very difficult scheme to implement. If we were trying to get those sort of volume cafes, the TGI Fridays and big chain restaurants in there, it would look very difficult. But I don't really think that's part of what we're planning to do there. I mean, the big steps we need to make in Prestwich are to try and consolidate the public sector's ownership of lots of different sites into a single efficient building, and that's something that needs to happen irrespective of movements in different kind of consumer markets.
Leader, can I make a comment?
Eamon, please.
It's just about Prestwich. I think we need to be, honest that the issue in Prestwich has really been a failure of the private sector investment not bringing forward a regeneration scheme. I mean, there's been multiple opportunities since 2008 for private investors and private owners to come forward and produce a scheme, and that's not happened. That's not just casting dispersions, it's just it didn't come forward, and that's evident. What we've tried to do, I think, over the last year, and Paul, you've really sort of driven this, is the council takes a bigger role in bringing forward a scheme, but in partnership with various different private and public organisations. What I think is probably an opportunity in and amongst all this, and very much on the point that Paul Cropper made, which is that, if we're going to have a recovery, it is going to have to be driven by public spending, in my view. And I think the government are probably more open to that argument now than ever before because of the money that they've been spending. So it's actually an opportunity to drive forward what we were planning in the first place, but with perhaps more opportunities around the government supporting us. So in some respects, yes, it will be a totally different atmosphere, and it may require, a different model. But the purpose of what we were trying to achieve, which is a greater public interest in the scheme, will probably be bolstered or can be bolstered under these circumstances. So I think I'm confident we can still progress things in Prestwich. It may be different from what we originally intended, as Paul says, but there is still plenty of opportunity out there, and it's about driving forward the vision first, and then bringing in the funding that could be there as well. So it's not by any means dead, in my view.
Yeah, agree.
Yeah, thank you. Yeah, I mean, I'm trying to push this along now. We've been here an hour and we've still got a couple of matters. Do you want to respond, Paul Lakin? Do you want to respond? No,
I think Councillor O'Brien put that very adequately. Yeah. That's exactly what I think the tone of the development has to be.
Thank you. Are you all done for comments then to Paul Lakin, colleagues? Good. In that case, Donna, are you with us? Are you on the call? I can't see you. Where are you? DB. I can't see DB. Poor old DB's left us. Donna, are you with us?
She's down at the tip, Leader.
I can just remind members, if it's helpful, what this is the burial cost, isn't it?
That's right. It is, Lynn. Yeah. Thank you.
Yes. So just to remind members, I think we've discussed this before, and I think you're aware that we've had some questions, particularly from the Muslim community, who experience higher burial costs because of some of the faith specifics. We've been asked around flexibility of charging if there is more than one death in a family during the current pandemic. The proposal is that we do move to a position where the council absorbs 25% of the costs of a second burial for any faith group during the current context. So it would be a temporary arrangement only. I'm sorry, I've not got the report in front of me. I'm not quite sure how long the proposal is that we offer this for, but we make this as a flexibility and recognition that cost to families could unfortunately be an issue. We don't think it will be a significant cost. I know Donna had talked around there just been one recent case we were aware of in the same family within just a matter of days. So unfortunately, I think it will happen, but I don't think we would hope it will be a massive issue for us, and it will be a direct response back to the community who've asked.
Yeah, I think you captured that, Lynn. That was my recollection. Does anybody have a comment? We can always pass it on to Donna if colleagues have anything to ask. It seemed a common sense thing to us at Cabinet this week, so I think we can take that as read. No questions from colleagues.
And it would be, it's a 6-month arrangement. Julie's just messaged us on the meeting chat. Thank you, Julie.
For 6 months, yeah. And the second death had to occur within 3 months of the first.
That's right.
In order to qualify, yeah. So we can park that one, and we'll move on to the other urgent decision was about payments for agency staff and supply workers. This was to give them parity effectively.
Yeah, this one is mine, and yeah, absolutely. This is in recognition of the fact that public service staff effectively aren't covered by furlough arrangements, but we have got some staff that sort of effectively their agency staff whose ability to work is compromised because of service disruption at present. So the suggestion is that we apply the furlough terms to staff in that situation. We pay them 80% of their pay. There wouldn't be a direct cost to us because those costs would be in staffing budget anyway. So there wouldn't be an increase in cost, but clearly there's an opportunity cost, because they wouldn't be able to work, but that feels consistent with the spirit of government to do for local people. That it is a position across Greater Manchester that is consistent. Certainly, have you lost me?
Yeah, I'm afraid you're breaking up, but I think we've got the gist of it, Lynn. Thank you.
All right, thank you.
Got it, but the line is not good at the moment from there. So the question is this an urgent decision? Does anybody think that it isn't? No. In that case, that one's a done deal, I think, Lynn, is the terminology. Attached to the papers is the operational report log. And then...
Councillor Jones. Sorry, it's Julie Gallagher. Sorry. Can you hear me? Councillor Caserta wasn't in for the urgent decision. I'm just having to readmit him. So we just need his approval again.
Where did he go, Julie?
He's in and out at the moment. I'll get his approval. He's gone off again. I'll get his approval offline. Okay. Okay. All right. As long as we do things properly, that's important. And then the notes from the Emergency Powers Group last week are attached at the back. So my last comment then is to Joe. Joe Tinman, are you still on the line? No. He didn't join us, Councillor Jones. No, did he not? Oh, right. No. Well, I thought we were right. Okay, fine. In that case, that concludes today's business. Can I thank everybody for your time, and I'll speak to Cabinet members tomorrow. Thank you. Thank you. Thank you.